Hi friends, today we are going to see the past year NEET questions for the chapter Chemical Coordination and Regulation. Today in this video we are going to cover part 3. So initially we have completed 2 parts. So kindly go through so that this will help you in the continuity with the other parts as well. So let's begin with the first question, which was asked in the year 2004. Which one of the following pairs correctly matches a hormone with a disease resulting from its deficiency? So we have to analyze here. Luteinizing, failure of ovulation, insulin, diabetes insipidus, thyroxine, tetany, parathyroid, diabetes mellitus. So the one which is correctly matched, if you see, it is luteinizing, failure of ovulation. Luteinizing hormone stimulates ovulation, as we all know. Deficiency of insulin causes diabetes. Okay, mellitus. Therefore, diabetes insipidus will not come for insulin. Okay, and if you have deficiency of ADH or vasopressin causes diabetes insipidus. Deficiency of the parotid hormone causes tetany, and deficiency of thyroxine causes cretinism in the infants and myodexma in adults. Therefore, the right answer to this question is option A. Let's move to the next question here. Which of the following hormone is not a secretion product of the human placenta? Very easy question. Which one it is? See, HCG, progesterone, estrogen. All these are from the placenta. Now, if you see prolactin, I said it is associated with the milk. That is the one thing which is not from the human placenta. While if you take HCG, estrogen, progesterone, all these are there. Prolactin is secreted from the anterior lobe of the pituitary, and placenta secretes human placenta lactogenic factor, which prepares the mammary glands to secrete milk. So prolactin is not from the human placenta, it is from the pituitary gland. Therefore, the right answer to this question is option B. Next question here. Which one of the following pairs correctly matches a hormone with a disease resulting from its deficiency? Very easy question. The first one is not rightly matched. Insulin is diabetes mellitus. Relaxin, no. Prolactin, no. Parathyroid hormone is related with tetany. That is right. Deficiency of the parathyroid hormone causes tetany. This disease causes sustained contraction of the muscles of larynx, face, hands and feet. So that is called or defined as tetany. Therefore, the right answer is option D. Next question here. Melanin protects us from dash. We say, right, the more the person has melanin in their body, they look dark. That is not dark, they look brown. That is why you see many who want to become fair, they remove the melanin from their body so that they will look fair. You have a lot of treatments for that. But still, what I would prefer is, or what I would recommend is, melanin is very good for health. Okay, melanin actually protects your skin from UV rays. So melanin is very good for health. So artificial removal of it will actually have any side effects in your body. Melanin is secreted from the intermediate lobe of the pituitary. Melanin mainly protects our skin from the UV rays. People living in tropics tend to disperse more melanin in their skin because of the adaptive feature which the body accustoms. Therefore, the right answer to this question is option A. Next question. Mainly which type of hormones control the menstrual cycle in human beings? Very easy question. So what are the hormones which are responsible for that? We have follicle stimulating hormone, we have the luteinizing hormone, we have estrogen. Therefore, the right answer is option C. During the menstrual cycle, a negative feedback prevents the secretion of estrogen. FSH stimulates the maturation of the Graphanian follicles, and LH stimulates the ovulation and development of the corpus luteum. So as you all know, when we talk about menstrual cycle, it's a 28-day cycle, right? Yes, the cycle, if the woman is very normal, okay, the person will have it as 28-day cycle. If the hormonal imbalance or any kind of disorder, might be thyroid or something, which any disorder might lead to hormonal imbalance, and there might be missing irregular periods, you call it as. Therefore, the right answer to the question is option C. Next question here. When both ovaries are removed from rat, then which hormone is decreased in blood? Ovaries. What happens? Ovaries are very important. They are responsible for the production of estrogen. Estrogen is released from the ovarian follicles. Oxytocin is secreted by the posterior pituitary gland, and prolactin, if you see, it's from the anterior pituitary. Gonadotrophin releasing factor is produced from the hypothalamus. Now, when you remove the ovaries, therefore estrogen will not be released in the rat. Therefore, the right answer is option C. Next question here. Acromegaly is caused by dash. What is it? It is a deficiency. Before we go into that, let's discuss. Before we go into the answer, let's discuss what is acromegaly. So, acromegaly is a disorder. Okay. A common sign of acromegaly is enlarged hands and feet. Acromegaly may also cause gradual changes in the shape of your face, such as protruding lower jaw or burrow, enlarged nose, thickened lips, wider space between your teeth. So if you ask me what is this, it's usually caused by the non-cancerous tumor. Middle-aged adults are mostly commonly affected, a disorder in adults in which pituitary gland produces too much of growth hormone. So now you will know what the answer is. The right answer is because of the excess of growth hormone which is released in the body, and mostly this is seen in adults, middle-aged adults. Therefore, the right answer is option A. Next question. Which of the following radioactive isotope is used in the deduction of the thyroid cancer? So thyroid cancer. So when we talk about thyroid, we all have to remember that we are inculcated to intake iodine. Right? Iodized salt is very much required. Therefore, for the deduction of the thyroid cancer also, you will use the same iodine 131 to detect it. Okay, for the confirmatory test. Therefore, the right answer is option A. Next question here. Melatonin is produced by dash. Very easy question. It's a repeated question. Melatonin is secreted by pineal body, and that is associated with the brain. It is present between the cerebral hemispheres. Melatonin concentration in the blood flows in a diurnal cycle. It rises in the evening and drops at noon. Melatonin lightens the skin color in certain animals and regulates working of the gonads. Therefore, the right answer to this question is option D. Next question here. Melanocyte stimulating hormone is produced by dash. So we just now saw melatonin secreted by pineal body. Now melanocyte stimulating hormone. It's from the pars intermedia of pituitary gland. Okay. Parathyroid gland secretes parathormone, which regulates calcium 2+ level in the blood. Anterior lobe of pituitary secretes the following hormones. That is, what are the things it secretes? The growth hormone. Then you have ACTH. Then you have thyroid stimulating hormone. Then you have FSH, and you have LH. The intermediate lobe, okay, of the pituitary gland secretes this hormone, which causes dispersal of pigment granules in the pigment cell, which gives color to the skin. Now you can ask me a question. See, pigments keep changing for animals, not for humans. That is why, however we try to lighten our skin color, we cannot do it to utmost. If you are going to do it by natural ways or by adding some cream, something or the other sort, at that moment you will find brightness, but after some time you will come back to the original color. Either if you go for some surgery or some removal of melanin, maybe that will help. But otherwise, your skin will not lighten naturally. Okay, you can only enhance to some extent, but becoming fair all of a sudden in the night, all of a sudden is not possible. That's the truth actually. Therefore, the right answer to this question is option B. Next question here. Progesterone, the component of the oral contraceptive pills, prevents pregnancy by dash. So you must have heard about these pills, right? But it's illegal to do it, but still we do it. What to do? So these contraceptive pills, are used to avoid unplanned pregnancies. That's the right way to put it. Contraceptive pills have estrogen and progesterone. Progesterone will suppress the ovulation and production of LH, while estrogen will suppress the production of FSH. So it will block the ovulation. Therefore, the right answer is option C. Next question here. Oxytocin helps in dash. It is the other name for oxytocin is very interesting. It is called as the child birth hormone. Okay, it's called the childbirth hormone. As you know, prolactin helps in lactation. Luteinizing hormone levels the triggers of ovulation. Oxytocin helps in childbirth. Therefore, the right answer is option B. Next question. A candidate vaccine for male contraception is based on dash. What is it based on? We're doing it for a male. Obviously, it will be based on the male sex hormone. So, out of 4, the right one is option C, which is testosterone. Very easy, right? So, the hint for you is in the question itself. Next question. Insulin differs from the growth hormone in that what? So, this question was asked in the year 1999. Analyze the statements here. It stimulates the lipoprotein, no. It increases the transport of amino acid, no. It increases the mRNA or ribosome activity, no. Actually, it stimulates a hormone-sensitive lipase in fat cells. So, insulin is released from the pancreas, as we all know, and it helps in the conversion of the glucose to fatty acid. It increases the fat synthesis in the adipose tissue. Therefore, the right answer is option D. Okay? Fine. I hope you understood whatever is being explained in this part. So with this, we complete the part 3 of chemical coordination and regulation. Hope to meet you in the next part with another set of questions. Thank you.